Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidiri. We're going to kickstart the show with a very, very concerning unfolding of events. We'll be starting the show in Gaza, where yet another form of collective punishment is quietly killing. Fuel restrictions. Israel's ban has brought hospitals like Al-Aqsa and Nasser to the brink of collapse. In some cases, literally lights out during surgery. And joining us right now is someone who's seen the crisis unfold firsthand in a lot of fronts. We'll be speaking to Dr. Mimi Syed. She's an emergency medicine physician who served in Gaza's Al-Aqsa and Nasser Hospital in 2024. Dr. Mimi, thank you so much for joining us. Really, really appreciate you giving us your time to unpack this very, very concerning piece of event.
Yes, hi, thank you for having me.
Mm. I
Yes,
think
go ahead.
Yes, I think you were on the ground in Gaza back in 2024. When you hear of a fuel ban today, considering just how much the Palestinian medical fraternity in the field itself has been through since October the 7th, when you hear that there's a fuel ban on what remains of hospitals and healthcare, what memories or scenes come back to you immediately, and what kind of impact do you see that having?
I mean, honestly, I'm not even sure how the healthcare system is even providing any amount of care to patients. Based on what I saw when I was there, it just got exponentially worse as I kept going. I went twice, once in August and once in December, and each time I went back, it was significantly worse than the time before. Currently, there is a blockade, as we all know, on humanitarian aid including fuel. And the fuel is unfortunately is necessary to keep the major functions of the hospital going. And from what I understand, there is a power outage. Some physicians, I noticed some surgeons doing surgery by cell phone light for several hours. They had major critically injured patients that they were working on, and there's video of this. They're doing it by cell phone light. That's unheard of. And the fact that this is continuing to happen even so long after is just it's unfathomable that these deplorable conditions continue to exist.
Mm, mm, mm. And I think what's really, really concerning is beyond just fuel, we're hearing about a total breakdown of the health system, as you mentioned, destroyed labs, failing blood transfusions, blocked aid, as you mentioned. Um, if you could just analyze the state of Gaza's healthcare from what you're gathering from your colleagues who are still there, to your experiences at this current moment, what would you share? What's the lived and true realities of the doctors and the patients who are working under extreme conditions at the moment?
Yeah, I mean, you're talking about a population that has been mass starved, right? I mean, they're continuing to be starved. I have colleagues that are telling me that they're eating 250 to 400 calories a day. That's just not sustainable. There hasn't been any substantial aid that has entered. And even with the GHF, the Gaza Humanitarian Foundation, I mean, that is nothing but a death trap. It is claimed hundreds of lives already. And the situation just continues to get worse. I mean, we have also the threat of now meningitis that at Nasser Hospital that they're seeing in babies, malaria, chickenpox, all of these infections that because of the terrible sewage conditions that's already existing, but just continuing to get worse. Now we have the warm temperatures that just compounds all of these devastating conditions. But the lack of clean water, for example, I mean, it's just a breeding ground for infection, and it just continues.
Mm, mm, mm. I want to touch on the GHF, as you mentioned, this organization that is currently giving aid or supplying aid to the people of Gaza, and it has turned literally to a death trap. I mean, more than 600 Palestinians have been killed while seeking aid from GHF sites. What do we know about this new modus operandi of the people of Gaza being called out to seek seek aid in these, aid spots by the GHF, and then fire is opened on them. I mean, it's just mind-boggling how it feels like a movie. Even it's like a dystopian movie. It just doesn't feel real.
Exactly. I mean, it's just a sick and twisted way to just dehumanize Palestinians even further. Just think about how that is. You have parents, mothers, fathers walking miles to get to a point to get just drops of aid, only to be shot at. This is a fact. There were foreign doctors at Nasser Hospital that received dozens of people that were shot by snipers when they were trying to get aid. We're seeing the images come out live from Gaza still, that continue to come out, children that are being shot and sniped. And it's a sick and it's a twisted, just another way of just completely dehumanizing Palestinian people. And, this guise of saying that Hamas is going to take the aid if we give more aid and we have to control it. I mean, these are all just lies, because if you were really worried about Hamas taking the aid and selling it, what you would do is just flood the markets with aid so that there's no value to it, and then everybody has food and it's a win-win situation. But this is just
Mm.
another way to make excuses to continue to kill Palestinians, and that's what's happening right now. That's what we're seeing.
Mm, mm. And if there's one thing we can't, stop talking about, and we should mention quite a lot, is the fact that majority of those affected are young children. I follow you on Instagram, and one of your posts was actually, you saying that returning from Gaza each time you were shocked that over 80% of your patients were children. Just how much are children suffering in Gaza? What's the state of child health care in Gaza, and how is this genocide affecting them primarily?
Yeah, I mean, I don't think it's a secret now. I don't think that this is something that people don't already know, but 50%, over 50% of the population of Gaza are children. So naturally, the children will be disproportionately affected by this. The conditions that have been deliberately manufactured by the Israeli government are going to affect children first. For example, starvation. When you have starvation, the first people in the population that are going to suffer are small babies, and then children, and elderly population. And so you're directly impacting the survival rate of these children, and that's why we're disproportionately seeing children affected by this. The sniping of children. I mean, we know that the Israeli military deliberately targets children. It is something that we have all been seeing even before October 7th. But when I was in Gaza, absolutely, the number of patients that I saw, disproportionately, almost over 80% of the patients that I saw were young children. And I'm talking about like less than 12 years old. And and I'm not the only one. If I was the only one saying this, I could understand, that okay, maybe it's just me and my numbers, but every single foreign doctor that has gone into Gaza has said exactly the same thing. We don't know each other, and we've all independently witnessed all of these things. And so, of course, these are children that are suffering, and this is a war on children.
Mm, mm, mm. Can you maybe just describe for our listeners, if there was ever a specific moment during your time in Gaza when a lack of fuel directly endangered a patient's life during your time there? What does that do to a medical professional emotionally? When you have the skills, you can save this person's life, but the resources, number one, which is being fuel, it's just not there.
Yeah, I mean, there are so many examples of that, but fuel is used, for many things there, of course. The electricity grids have been completely destroyed in Gaza, just to give people an idea. And so fuel is used for the backup generators, and the water filtration systems that are used there are backed and done by fuel. And so we would see repeatedly small children coming in with chronic diarrhea that were completely dehydrated. I remember a 9-month-old baby that came in repeatedly for dehydration because she had chronic diarrhea, and ended up coming in and succumbing and dying because they would just go back to these deplorable living conditions with dirty water that was contaminated with E. coli and came in with organ failure and just ended up dying. Something completely preventable, unnecessary, but just, is a common thing. Thousands of children are affected by this. Every single child I saw in Gaza as a patient had diarrhea. And this is all due to those conditions. And it's compounded now by starvation. So
Mm,
you have a population that's already starving and already undergoing these atrocities, but now even if they do get treated by a doctor in the hospital, they can't heal from their wounds. And another thing to mention is they have been starving for so long. You can't just feed a population now. It has to
mm,
be done, methodically. And giving someone food when they've been starving for months, that's also very dangerous. And so, we're ignoring these things and kind of just turning away from all of this. But these are just extremely important, and it will not go away just because there's a ceasefire. There is long-standing work that needs to be done. Aid needs to be flooded into Gaza, unlimited aid. And of course, the ceasefire has to happen. And it has to be a sustained, permanent ceasefire.
no, definitely. Dr. Mimi Syed, we're going to leave it here for now. Thank you so much for joining us.
Thank you.
That was Dr. Mimi Syed speaking, I think, not just as as a physician, but as a witness to a healthcare system being deliberately dismantled, patient by patient, generator by generator. And what we're seeing in Gaza is not a collapse of service. It's not a lack of resources of any kind. It is the weaponization of deprivation, and it's targeting the most vulnerable, babies in incubators, dialysis patients, the sick and the displaced. And with the electricity grid, being completely decimated, I think you can hear from Dr. Mimi side there. Fuel in Gaza has literally become the difference between life and death, and denying it isn't policy of any kind; it's persecution. This news and views on Salam Media. We're going to take a quick break. When we come back, we'll be shifting our focus now to the continent of Africa, where we'll be focusing on the Sudanese refugee crisis and just how that story in itself is not given the attention that it deserves. I think on the continent right now, when you look at Sudan, it is the main and most pressing humanitarian crisis that the continent is grappling with. And we'll be looking at it with MSF Claire Sanfilippo. She's the emergency coordinator at Doctors Without Borders. So stay tuned in. We'll be back with you after this.